Hello and welcome to our Infection Prevention Week live stream. So we've been talking about infection prevention all week and we've had all sorts of fun and interactive events. And why are we doing that? The reason we've done that is you may not know this, but since about 1980, people from all over the world have participated in Infection Prevention Week, which is now in 2021 is more important than ever, with especially when you consider COVID-19, right? And so we're doing this to continue to spread awareness and highlight the people who fight against infectious diseases and germs every day, much like COVID-19 and some of the other infectious diseases that we know about. So today we'll be speaking with our very own professionals in the field, and they'll give you a rundown of some of the work that they've done this week with this program that we've had. So we'll hear from our nurse and infection prevention specialist, Rhonda Morris. She'll be talking to us, and she was one of the organizers of this week's program. And we'll also be able to hear from Azar Gaminian. She is one of our senior health educators, and she teaches a lot of our courses here at the health department. And finally, we'll hear from Deborah Maxwell, and she is one of our grand statisticians, and she is also over a program called Project First Line. We'll hear a little bit more about that, which specifically speaks to infection prevention, healthcare professionals. So without further ado, let's just go ahead and get right into it. So I have a few questions here, and people are really wanting to hear from you guys. So just relax and just open up and let us give us some of that insight that you've gained from participating in Infection Prevention Week. So first question for Miss Rhonda. So Rhonda, how are you today?
I'm doing wonderful. How are you today, Miss Gwen?
Great. You look good. It's good to have you here.
Thank
I
you.
want to start off this first question for you. Why do you feel it's important for HHD to participate in International Infection Prevention Week?
Infections are everywhere. Infectious germs are everywhere. And we, as a team here in Houston Health Department, are trying to continue to fight against infectious germs. So the more we know about how to protect ourselves, the better we can protect others and our coworkers, the more that we can stop and slow the spread of COVID-19 and infectious germs. So International Infection Prevention Week is something that we do to help highlight and help others understand that we must continue to keep our guards up, continue to fight against COVID-19 and infectious germs. And the education we got all throughout the week was very positive and helpful in knowing how to continue to prevent contracting and infection and germs.
Thank you so much. That last part, just kind of leads right into my next question. And I'm going to switch to Azar for this next question. How are you doing today, Azar?
I'm doing well, Miss Gwen. How are you?
I'm wonderful. Great to have you. So Rhonda was speaking about the importance of, understanding and helping our team to understand how infection prevention correlates to, containing disease. How did COVID-19 and the pandemic shape your approach to this year's Infection Week Prevention Week activities?
So last year, the IIPW focused on celebrating infection preventionists, so IPs, for their bravery and tireless efforts during the pandemic in 2020. So for this year, this year's theme was Make Your Intention Infection Prevention. And that really seeks to highlight the science behind infection prevention and seeks to inspire the next generation of IPs to join the fight. And so I believe with all the activities that we planned during this week, the courses that were taught as well, really highlighted making infection prevention as part of our daily routines.
Thank you so much, Azar. And you mentioned highlights, and that again just segues very well into my next question. And I'm going to pose that to Miss Deborah. How are you doing today, Deborah?
I'm doing well. Thank you. Thank y'all for having me today.
Good to good to be here, and thank you so much for joining. And so, Azar was just speaking about highlights this week, and I actually want to ask you about that, but just put a little twist on it. What have been some of the highlights this week as it relates to your goals and objectives?
That's a good question. I think for me, some of the key highlights that I saw related to the goals and objectives was just seeing the staff's enthusiasm for infection prevention and their support and engagement with some of the activities that we planned for this week. One of the key outcomes that we wanted to happen by launching the International Infection Prevention Week here at the local Houston Health Department was to really increase awareness of the need for infection prevention. And not only that, but our Project First Line classes that we have here happening locally that are free. And so through this week, we really seen increased participation and increased awareness of our objectives. So I'm definitely excited about that.
Awesome. Yes, and those are some great classes. Anybody listening, if you haven't already taken them, we'll give you some information about that later so that you can take that opportunity to get that education. And so, my next question is actually going to be for all of you. I want you all to think about this and answer. And I'll start with Rhonda first for an answer. But the question is, I know that during Infection Prevention Week, we kind of had these things going on every week. And I mean, today's theme was the crazy socks theme, and I do have my crazy socks on. I'm not going to show you all, but I'd like to know which daily thing was your favorite and why. And I'll start with Rhonda.
Thank you, Gwen. My God, it's so hard to choose which one. I think I'm going to choose the hand hygiene protocol one that we had that we started International Infection Prevention Week with. And the reason why I say that because we did a hand washing demo because we all talk about hand washing all the time, and it's good to see positive feedback and on-demand feedback. We did the hand washing demo, put some glow germ on people's hands, and because a lot of people say, "Oh, I know how to wash my hands." This is all about education, right, and preventing infections, right? So we had them go wash their hands, and they come back, and we look at them. They get instant education, right, to say, "Oh my God, I need to." Step it up a little bit and washing my hands. So I like that because even though sometimes we know how to wash our hands, sometimes we forget to wash our hands and do it properly. It's not that we don't do it, it's just that sometimes we just need a little bit more pep or a little bit more enthusiastic to make us pay attention to washing our hands. So that was the best part, I think, of getting that instant feedback and people was being surprised, like, oh my God, I got germs still left on my hands. But it helped. It helped. And I like the number one, the Monday hand hygiene one.
Thank you. And I did participate in that as well. And so, true confession, I'd probably, because it was a test, probably went a little extra to make sure I didn't get a bad report when I came back and had you put that light on my hands. But yes, I agree with you. That was an excellent exercise. And
Stood longer in there because we knew it's the goal is to get you to wash your hands and to do it properly. So people who stay a little bit longer, that's fine. The message still went through
it
because
got through. Very good. Thank you, Rhonda.
thank you.
So next, I'm going to go to Azar. Which daily thing was your favorite and why?
Well, I guess I'll have to say yesterday's theme was probably my favorite. It was the Wear Your Red for appreciation for advocates of infection prevention. So to kind of thank your healthcare worker. And if you were able to catch us in the lobby, we had our table set up with thank you cards that were written by elementary school students and I think middle school students who said thank you to healthcare workers, health educators, pharmacists, epidemiologists, anyone who works in the healthcare field to really show our appreciation for all the hard work that they've done and just really highlight them and cheer them on.
I like that, Azar. Thank you. It's been said, an attitude of gratitude will get you further. So we appreciate you guys pausing in the program to show gratitude to people who do this work every day. Thank you. And so, last but not least, Miss Deborah, which thing was your favorite and why?
So it was really hard to choose a favorite with so many great activities happening. But if I had to choose, I would say today's theme was my favorite, just because I love socks. I love colorful socks. I love soft socks. So I got to wear my Christmas socks today. You can't see, but I have them on. So I like that. But more than that, I like the thought of correlating, wearing something on your feet to stepping out, stepping for action, calling ourselves to step up to express the need for infection prevention and to kind of spread that call across the city and across the nation ultimately. So today will be my favorite.
Wow, that's neat. I didn't know that about you, but now I do. So I got to start thinking about gift giving for you. But so that's great, guys. And I really love that you guys all had a different take on your favorite day and why it was your favorite day. And so it just kind of goes to show all the different things that we can pull out of these activities when we have them. So another important reason for hosting these awareness weeks. I have another question for you all. And so I'm going to ask again, and I'll just give you all an opportunity to answer. So, we worked a lot with pulling in and making sure that there was pretty much something for everyone. Were you satisfied with the level of participation from the staff that you got from the staff or from the public? I'll start again with Rhonda.
Hi everyone. Oh yes, most definitely. My expectations were exceeded. My goal was to get at least 20 people to sign up for our Project First Line classes a day, and it exceeded every day. So I'm happy about that. So, and the public was nice. I mean, CASA was ready. They were on board with their masks. We had a great time. So, and the staff here who didn't know about Project First Line know about Project First Line now. So I'm happy with the outcome. The expectations were exceeded, and I am just so grateful that people chimed into this infection prevention week and definitely want to know about our Project First Line classes to help educate them and keep their fire going about stomping out infectious germs like COVID-19.
Great. Thank you, Rhonda. I appreciate that. And so now, same question to Azar. Were
Yeah,
you
I just have
satisfied?
to. Yeah, I have to agree with Rhonda. I was able to witness some of the tabling events, and so just seeing the buzz around the table, the interest, and also seeing that transfer over to people registering for classes. Who there are several people who register for classes during this week, so that was really awesome to see everyone who's been interested.
Great. Thank you. And so we're going to be busy then making sure we have get all those people registered and in those classes the next couple of weeks, which is what we wanted. So good job. And so finally, Deborah, were you satisfied with the level of participation this week?
Oh, yes. I think I was beyond satisfied seeing the staff participate, attend the tabling events, submit their photos. I definitely was very satisfied with our staff's participation, and I definitely still challenge ourselves to continue to reach out to the public to get even more participation in our public because, a great amount of participation is awesome, but we always want more. So I'm still challenging us to do a little bit more too.
It's a great segue into my next question for all of you, which is, we always like to review and kind of see, hey, were there any lessons learned, any surprises that happened this week that you'd like to share? Rhonda?
I definitely had some surprises. I have had even teenagers and some little kids who were able to tell me the steps of hand washing, and I was like, they were telling me how to wash hands and how it helps keep germs down. So that tells me that the message is definitely getting through all ages. So that was a great experience right there at Casa, and it surprised me. I said, do you know how to wash your hands? It was like maybe a 6 year old, and it gave me the steps, did the whole demonstration, and I was like, oh my goodness! So the message is getting out. So that was a surprise, and we never can take it for granted. Who knows what? And it's always good to engage people and see where they are at, so that way you can better able to help them understand about preventing infections. So that was a great lesson, even for me. And because they're small, doesn't mean that they don't know anything. So that was a great lesson for me.
Awesome. We love it when the young students get involved and are aware, and sometimes can be the ones who are teaching the parents the lessons. So good job. Same question, Azar. Surprises, lessons learned?
I wouldn't say. I guess maybe I didn't have any surprises or lessons necessarily, but I did. Just seeing the interest in the topics that we covered over the week. I think it really goes to show how important this topic still is, and it's still interesting to people because it's something that we're going to have to continue to do, not just for COVID-19, but for other, just to keep us safe from infectious diseases in general. And I see how hardworking my team is, and I'm really proud of our team being able to share this information with the rest of the health department.
Awesome. Thank you. And you're right. Everything that we've been through since the pandemic is definitely has probably led to some changes that we'll probably make for the rest of our lives in a good way. So thank you for that insight. And Deborah, any surprises, lessons learned this week?
Yes, I think for me, the lesson learned, after the pandemic and everything that's been going on, we're having to physically distance and kind of stay to ourselves, but to see kind of now with the staff, I was kind of concerned to see if staff would be willing to kind of step out and come to events and things like in the nature to wear their mask and things like that. But it just kind of showed me that it's okay to kind of step out the box and be innovative, and especially now, there's still a need, and then that staff and the public are willing to participate as long as we're safe about it. We are still physically distancing, we're wearing our masks, we're sanitizing, and we're being safe. So we're able to have fun and have great events like this, but then still be safe at the same time. And it just kind of surprised me and just kind of showed me as a lesson learned. It's okay to be creative, think outside the box, and still have safety be your priority as well.
Absolutely. Very good. Thank you all for sharing. Well, this is it seems like it's come to a close so quickly, and it sounds like a lot of what we planned and what we wanted to happen, and as Deborah mentioned earlier, the goals and objectives were met, and it seems like we might be looking forward to next year. But as we wrap up IIPW, what are your final thoughts? Any final ideas or thoughts that you'd like to leave our listening audience with today, Rhonda?
Yes. Every day the world is fighting against infectious germs. We must continue to fight and protect one another as well as ourselves against global threats that we have, such as the pandemic that we're going through, healthcare associated infections, TB, measles outbreaks. Even now, we're in the flu season, and so many others. As this year's themes make your intention infection prevention, everyone can prioritize infection prevention in their day to day lives, right? And to make it better and to stop and slow the spread of infectious disease and germs that harms the public. Every day, we must continue to fight. We must not let our guards down. Prevention starts with knowing how to protect oneself, and by doing that, that person can protect others, and we can really truly slow the spread of any infectious germ. You learn how to fight back with knowing how to fight, and that is what makes the difference. I'm happy to know that people are still interested in learning how to better protect themselves and those who are close to them. Let's keep up the fight.
Excellent. Thank you for those closing comments. Azar, any final thoughts or words?
Yeah, just to kind of echo Rhonda, I think we as individuals can do our part to not only keep ourselves safe, but to keep our coworkers, our family members, our community safe by following these simple infection prevention measures like washing our hands, wearing our masks, and continuing those efforts to keep each other safe.
Very good. Good advice to follow. Thank you so much, Azar.
Thank you.
Deborah, any final thoughts?
Yes, well, everyone already has stated it, I think, perfectly. But I would just want to say thank you to everyone that's participating. Thank you to everyone that daily practices infection prevention, because it takes everyone doing their part to really make sure that we prevent the spread of infectious diseases like COVID-19 from spreading in our workplace, where we pray, where we worship, where we have fun, where we eat, everywhere that we go. We want to make sure that we keep ourselves and our family and community safe. So thank you all for doing your part.
Thank you so much, Deborah. And that is an excellent lead in to our next component of this live stream, which is the importance of just the day to day practices that we do for infection prevention. And what I'm speaking of is what they have already stated several times: hand washing, mask wearing. They continue to be two of the most important things that we all can do, simple things that we all can do to help slow the spread and even stop the spread of infectious disease. So right now, here's a couple of videos on those topics.
Wearing masks can be a bit uncomfortable sometimes. I know, I get it. But masks are proven to slow the spread of infectious germs when someone sneezes or coughs. They can work for more than just COVID, you know. Remember to wear your mask securely over your mouth and nose for the best protection, even if you've been vaccinated. So keep masking up to keep not only yourself but those around you healthy and safe. Hey, did you know that your hands touch over 1,000 items a day? How many times have you touched your face today? On an average, people touch their face 16 times in 1 hour without even realizing it. With the spread of COVID-19 on the rise, hand washing is the most effective way to stop the spread. Remember, wash your hands often for at least 20 seconds every single time to avoid getting sick. It keeps not only you but those around you safe from infections like COVID and so much more.
All right. Those were fun and important. And most importantly, the messages behind the fun are real and true, and they will help us if we practice them. So I'd like to bring back one of our guests, Deborah Maxwell, who is also over our Project First Line program. And she's going to share with us a little bit about what that program is and how you can be involved. Hi.
Hi, Gwen. Thank you for bringing me back. Yes, I would love to talk about Project First Line. So I'm sure you're wondering what exactly is this Project First Line. So Project First Line is a CDC-led infection control training collaborative that's being launched here locally by the Houston Health Department and nationwide by other jurisdictions. Project First Line seeks to empower frontline healthcare workers with the knowledge and skills and resources that they need to really better practice infection control in their workplace and in their community ultimately as well, to better protect themselves, their family, their coworkers, and the community from infectious diseases like COVID-19. The classes and trainings are fun, they're short, they're interactive. We offer them virtually, on demand, and also in person for group classes as well. So they're very accessible to a busy work schedule, and we really try to be flexible as well. So we definitely encourage everyone to check out those classes. We offer them on a variety of topics from PPE to how to wear your mask, how viruses spread. We start to get into microbiology, and it really tries to appeal to everyone across different backgrounds and experiences. So Project First Line really is for everyone, no matter what your background is, your education level, your experience with infection control. Project First Line is definitely for you. And just here's a little sneak peek. If you do participate in our classes, we have some awesome collateral for you guys, such as this mug and tumbler. And then we also have some other great freebies too. So don't wait now. Just check it out and sign up today.
All right. Well, thank you so much for joining us. Thank you, Deborah, for that plug on and that information on Project First Line. I've taken a couple of courses myself. They are really great courses to have in your arsenal as we continue to fight COVID-19. Please follow us on all of our social media streams and visit us on gohealthyhouston.org and as well as the Houston Health Department website at houstontx.gov/health. Have a great day, and we always wish you wellness. Thank you.